Hi, it's the nursing professor here. I want to talk to you today about the integumentary system, which is skin. Skin is the largest organ of our body. It provides protection over our organs. It helps create insulation so that our temperatures are regulated. It is the number one type of cancer that people get. Why would you think that? Just think about it. It's the sun. Right? People don't wear sunscreen, they aren't protected, and so skin cancer is the leading type of cancer that is out there. So we have to do better than that in making sure that we're educating our patients. All right, so it has three layers. It has a top layer, which is the epidermis, middle layer, which is the dermis, and underneath that is the subcutaneous layer, and that's that last layer before you get to all of the fascia and muscles and bones and things like that, and we'll talk about that a little bit more. There are many factors that do affect the quality of our skin. So of course, aging is number one. The older we get, the more fragile our skin gets. You'll even see people, if you're in the supermarket or something, then many times older people, the skin is so frail, it doesn't look as smooth or as plump as it one time did. It has less elasticity, and we'll talk about how you're going to assess that. It gets hyperpigmentation, like you might see more moles, more age spots, different types of discoloration on the skin. Poor skin turgor. Okay, so when we talk about skin turgor, if you can remember from your lectures, then it is when you take either the back of your hand or the back of your arm and you're able to squeeze the skin like that. And so the skin should bounce right back. Okay, so when you pinch it up like this is called tenting, and then it should bounce right back. If it does not, then that could be a sign of dehydration. And so that is one of the assessment tools we would do when we're taking care of our patients. Mobility is very important. Can you imagine that if you're not mobile, how impaired your skin might be? Because that's how we end up getting pressure ulcers. People who can't turn and reposition themselves, then they are at a greater risk of skin breakdown. So the recommendation is to turn and reposition a patient every 2 hours at least. If you can do it more frequently, it's even better. If a person has had prior wounds, the skin never heals like 100% like it was before the wound. So anything that has any part of the skin that has a prior injury is at an increased risk for skin breakdown. Nutrition, hydration are equally important. If you have a person who has a wound, you'll know that it is so important to make sure they're having adequate hydration, adequate nutrition in order for that wound to heal. Okay. Sensory, again, sensory kind of goes along with that mobility. If your body doesn't have that trigger that I need to turn over, think about it. When you're at night in your bed, how you'll get a trigger to turn. This is why people toss and turn, because if you spend too much time like on one hip, your hip is going to start to hurt, right? And so you're able to turn your body over. Well, many of our patients have impaired sensory, and as a result of that, they're unable to do it by themselves. So we, the nurse, have to do that for them, or at least trigger them to turn themselves if they're able to. Moisture is one of the number one factors that affect skin, and that is people who are incontinent, or they might just have trouble getting to the bathroom, because there are people who can tell you when they need to go to the bathroom. However, because of their functional mobility, they can't get to the bathroom. And so for those people, I just tend to think nurses make life more difficult, because if you know a person is able to tell you when they need to go to the bathroom, we need to help them go to the bathroom at that time. Don't let a person become incontinent, because it really does increase the risk for skin breakdown, and it happens quickly. So never, ever, ever, you or whoever you're working with, make sure that they're turning, repositioning, and checking for moisture at least every 2 hours. Okay. A last factor we'll talk about is edema. And edema is a collection of fluid that's underneath the skin. So it's not only swelling, like you're walking down the street and you hit your arm and you get swelling as a response to that injury. It's not that. It is a collection of fluid underneath the skin that results from impaired circulation. And this is why it's very difficult if you're going to try to learn systems and think that you're going to throw it away, because our body is such a magnificent system overall that one impairment can impact the others. So as in the case of edema, then edema affects the skin, because we can only imagine with this collection of fluid, as it builds and builds and builds, then eventually that top layer of skin is going to break open. Remember what the top layer was? It's epidermis. Okay, it will break open and that person will end up with a wound. But the edema is a result of the impaired circulation. And so as you're learning these things, never, ever, ever think you can throw anything away. Try to make sure you can integrate the material so that you're looking at the whole body. And the more conversations you have about things like this, then the better able you really are able to hold on to the information, because you'll remember these discussions. All right, next on the list, lifestyle. Lifestyle also has an impact on our skin. So tanning, nobody needs to be out in the sun without sunscreen or using those tanning beds. Yeah, most people look better tanned. However, the aesthetics of it all is probably not worth the risk of getting skin cancer. And so we need to make sure patients understand that. Piercings, you know, I like my ears pierced too. However, as you're making that opening in your skin, you're also putting that area of the skin at a greater risk, because it's impaired tissue when you do that. So again, aesthetics is one thing, health might be another. Tattoos as well. You know, tattoos, people have tattoos. And so again, the skin doesn't heal like it originally did. And if anybody has a tattoo, you know that skin is a little bit thinner over that area. Bathing, taking too many baths or hot showers, make sure that the water temperature is a little on the cooler side, because hot water can really dry out the skin. Feels good, but you don't want that to impair your skin. And you'll notice too, if you take a lot of hot showers, that you must moisturize, because you're really taking all of the moisture out of your skin. And of course, last is infection. We all need to make certain that we are trying to avoid infection, but if we get infections, that it is treated and treated early. Because something as simple as, say, a mosquito bite or a splinter, that's a good one. Somebody gets a foreign body object in their nail bed, like a splinter. If that goes untreated, it will become red, it'll become inflamed, it'll become hot. And so before you know it, that can be an infection that started from a really small item there. And so our skin, although it is hardy and it protects our organs, it can also be very fragile. And so a total assessment of that really is necessary as we're caring for our patients. So, wounds, let's classify them. All right, so we can look at wounds as pressure ulcers. And we will classify them from stage 1 through 4, right? All right, so a stage 1 wound is closed. It's discolored, usually red, purple. Important for you to note that in darker skinned persons, it might not be a reddened area, it might look more purple. And so the key takeaway from stage 1 wounds are that they are closed. They're not open yet. Stage 2 wounds. This is when the top layer of skin is removed. Okay, so things about your stage 2 wounds. Many of these wounds are very painful. And why would you think that? There are a lot of nerve endings that sit right up underneath the skin. And so you'll notice, think about a paper cut. That little bugger is something else. It will give you a run for your money because it's so full of nerve endings underneath there. So if we're talking about pressure ulcers, a stage 2 wound can be very, very painful to a patient. Okay, so top layer is removed, painful. An example of that would be a blister. This one always got me. Like, how is this a blister? Blister ain't even open yet. However, it really is. It's just a thin layer that's sitting over this. Because you know when a blister pops, then it's an open area. So remember this, a blister is a stage 2 wound. I had a hard time wrapping my brain around that as a student. All right, stage 3, you all can't see that. Let me wipe that off, hold on. All right, hope you got this. Stage 3 wounds. These are a little bit deeper, right? So they are deep in the subcutaneous tissue. They're sometimes called partial thickness wounds. All right. Usually this has not gone as far as like muscle, bone, fascia, but it is deeper. It's deeper and it's in the subcutaneous layer. And so when we start to talk about injections, you'll need to understand where the subcutaneous layer is because that is where many medications is administered. So if you think about yourself, then if this is the top layer of your skin, the epidermis, if you lift up just a little bit, then you will get to the dermis. And then underneath that, when you start to feel some fat, that is subcutaneous layer. That's as deep as a stage 3 wound will be. And then final is stage 4. This is where you might see muscle, bone, fascia. Okay, these wounds are really deep. And actually, many people will say the stage 2 wound is more painful than a stage 4. Because think about it. You've gone so deep, you've kind of gone below the nerve endings. However, you will find some people who have quite pain in these areas. The other thing to note about staging wounds is that many times they're not all the same. So you might have one part of the wound as a stage 1, another part of the wound as stage 3. So be aware of that, all right? We also classify wounds as open and closed. Makes sense. Either they're open or they're not. They're closed. Acute or chronic, meaning acute, they just happen. It's a temporary state. Whereas chronic, people have this wound over and over and over again. So even though it might heal, it'll come back again if underneath the same circumstances. Clean versus infected. A clean wound, no signs of infection. An infected wound, of course, has some sort of bacteria growing in there. Superficial versus partial or full thickness. Superficial wounds are abrasions. It's kind of like you're a kid, you ran down the street and you just kind of skin your knee. That top layer of skin is removed, just the epidermis. That's considered an abrasion versus the other partial or full thickness. All right. Penetrating wounds is another way of classifying wounds, and of course these will be wounds that are stabbing, usually knife, scissors, some kind of sharp object. Okay. All right, so how are we going to heal these daggone things? All right, so wounds heal by primary, secondary, and tertiary intention. When we're talking primary, these are wounds that are healed by sutures, or what we know of as stitches, or what we know of as staples. So primarily these are surgical wounds where the doctor has made a nice clean cut and then he or she has started to close the wound edges. When you close wound edges, it's called approximation. So if this is a surgical wound, when the doctor finishes taking out whatever, then he or she will put them back together, and this is approximation. At this point, to keep these wound edges together, then there have to be sutured or stapled. Some type of closure has to happen. So as that wound heals, it's said to heal by primary intention. Secondary intention is when we allow the wound to heal from inside out. So many of these pressure ulcers heal by secondary intention, because what happens is that you will have a bottom layer, and so you allow that wound to continue to heal by that tissue just continue to proliferate and grow until it gets to that top layer where it can close in. The last layer is pretty much the last type of wound healing is called tertiary, and it's kind of a combination of them both, and that you will have a wound heal from the inside out. When it gets to the top layer, the epidermis, sometimes the surgeon is able to close that, and that wound will heal. Now, the great thing about a primary intention wounds is they leave very little scarring. Okay, so if anybody's ever had surgery, then you know over time that really you see like small remnants of that surgical incision. So the way we close wounds can be by an adhesive strip, which would be something like a Band-Aid or steri strips, something that's just kind of an adhesive that closes it. We can also have sutures, which are like stitches, surgical staples, which literally look like staples that you use for paper, however they are thicker, and surgical glue. Many times when there's a head injury, then they use surgical glue in order to close that wound. One thing to note about staples, when a surgeon put in staples, then nurses usually are the ones that remove them. So make sure you know how many were put there. So if there were 13 staples put there, then you need to make sure that you're removing 13, because if one is left in there, of course, that becomes a source of infection. Now, many times these open wounds have a lot of drainage, okay? And so drainage can be a sign of some kind of complication happening, like an infection would be a common one. Another type of complication you might see in wounds is what we call dehiscence. Dehiscence is usually something that happens in the abdominal incision, where, going back to the sutures, person had an abdominal wound, doctor closed it up, put some sutures around here so that wound edges are like this, but something happens to make this break open, okay? So usually when it breaks open, then the only way to continue that healing is the doctor won't come back and put in new sutures. What he or she will do is allow that wound to heal from the inside out. So think secondary intention. Remember, from the bottom up. Now, an emergency complication of wounds can be what we call evisceration. This is when the wound dehisces and actually an organ comes out of the body. Usually that organ is a part of the intestine. That is a medical emergency. If the person is at home, they need to get to the emergency room right away. If that person is still in the hospital, then you need to call the surgeon right away. Okay? All right, so let's go look at the nursing process as it relates to skin. Assessment. We can use tools like Braden scales, push scales, Norton scales. So what they are tools that we use for assessment. So we're looking at the skin, inspection, we're palpating the skin, we're making sure the person's mobility is okay, that they're continent, that their nutritional status is okay, because all of those we've already said impacts the health of the skin. And so when we're doing an assessment, we need to do all of that, not just a piece of it, not just look at a person's skin, because the skin might look okay, but if we find an alteration of any of the other things, like a person having poor nutrition or poor hydration, or they're incontinent, then that's going to put them at a greater risk. So your assessment is going to include inspection, palpation, assessing hydration, nutrition, mobility, incontinence. Okay? All right, so moving on, that's your assessment. We go into the diagnosis. This is a nursing diagnosis. It could be alteration in skin integrity, meaning that the skin is not healing. There's some sort of cut there that hasn't closed, or impaired tissue integrity, meaning that that wound might have become infected and is not healing in the way that we had hoped it would heal. All right, so next is what? P, plan. We're going to come up with a plan on how we're going to take care of these wounds. And so our plan should include, first of all, prevention. It should include goals that are time sensitive, like we want the person wound to, heal by 3 centimeters in 4 days. It should be something like that that is measurable. Interventions would include things like teaching, turning and repositioning your patient, cleaning the wound, nutrition, hydration, exercise. Exercise is very important because it gets the blood flowing in those areas. Pain medicine might be a part of the intervention if your person is having any type of pain. Okay. All right. And then, of course, we evaluate if it's doing fine. Good. We keep on about our business. We keep doing the same things. If it's not, that wound doesn't heal like we want it to, then we need to go back to the beginning and come up with a different plan of care. Now, got a question for you. You're assessing a 55-year-old who has tenting on the back of their hand. Recall, tenting, squeezing the top layer of skin should bounce right back. Which factor or factors should the nurse consider as the cause of this tenting? Select all that apply. Okay, so A is thin skin, B is loss of adipose tissue, C is dehydration, D is diminished skin elasticity, or E is excessive wrinkling. So when you're looking at this question, you're going to look at age first. This person is 55, so that's kind of middle age, not really elderly. And so you're going to base your answer on that. All right, so put your answer in the comment section down below. Bye for now. We will see you next time.